to the men and women who serve, and this is the cost of war. The veterans who are serving today cannot wait any longer. Their families are counting on us. They're counting on Congress, and we must deliver. I now want to recognize another one of my colleagues, Dr. Ruiz, who has been working tirelessly on this issue and brings great expertise as a medical professional to our committee and to the Congress to share his remarks and his story about the work that he's been doing for so long on this issue.
Thank you very much, and thank you for being here. Good morning. I'm Congressman Dr. Raul Ruiz. I represent California's 36th Congressional District. I'm an emergency physician, public health expert, trained in humanitarian disaster aid, and I'm also the co-founder and co-chair of the bipartisan Burn Pits Caucus in the House and the bicameral Burn Pits Caucus in the House and the Senate. I want to thank Chairman Takano for his leadership, all of the VSOs and their leadership who have worked tirelessly for their members to bring this to where it's at. And I also want to thank Congresswoman Luria, Congresswoman Slotkin, and the Jon Stewart, Jon Feal. It is no doubt that because of their outreach and their advocacy that we are where we are today. And I'm here because of the clarity of the problem. You see, our government does not hesitate to send our young, healthy men and women to fight the wars that they determine are needed. But they come back, and although they survive the battlefield, they are delayed casualties of war due to their exposure to terrible substances, toxins, that can cause respiratory illnesses, cancers, and autoimmune diseases years later. This is a self-inflicted Department of Defense wound on our service members. Then, when they come home, they face bureaucracy. And for many years, they were denied recognition that their shortness of breath could have been due to their exposure to the toxic smoke and plume that they breathed in while they were serving our nation. Some Department of Defense doctors told them that they were just making excuses. You just want to leave the service. Some of our veterans, and you'll hear stories today, would require 100% oxygen in order to breathe and stay alive at all times. These are young, healthy men and women that have no other risk factors in their lives to then suddenly have subtle shortness of breath when they walk upstairs, when they can't go for their 5-mile runs in the morning. That leads to anxiety. That leads to depression. That leads to suicidal ideation when they realize they cannot provide for their spouse, for their children. That is the human element of this horrendous circumstance that our service members and our veterans find themselves today. And that is why it is so important that we recognize this self-inflicted wound, that we recognize the service connectedness of their illness and their pain and suffering to their service for you, for me, for our children, for our parents, for our nation. This bill does just that. It has components, and the way it's laid out is very, very similar to the bipartisan legislation that I introduced with Senators Gillibrand and Rubio and Congressman Fitzpatrick, the Presumptive Benefits for Warfighters Exposed to Burn Pits and Other Toxins Act. The Honoring Our Pact Act has presumption of service-connected illnesses to receiving the care and the benefits that our veterans need, deserve, and earn. Anything less than that is failing our veterans. anything less than recognizing that presumption of service-connected illnesses is delaying further for possible decades the care and the benefits that they and their families need. Now, my staff, with some medical fellows, looked at the list and the literature and ranked the amount of respiratory illnesses that had good, strong evidence association with these toxins. Those illnesses are listed here. We also know that this smoke has hundreds of toxins and carcinogens that can cause an array of cancers. Those cancers that have been presented through case studies and others are listed here. And that is why it is so important that we must act now. That is why it is so important that we hear the stories of our veterans, to reach our collective humanity and patriotism, to support them and their families for their sacrifice for our country. And that is why we will not allow what happened to our Vietnam veterans when they were exposed to Agent Orange, and we will not allow this to be the Agent Orange of our generation. This is our time. We must act, and we're going to get it done. Next, I'd like to turn it over to a friend and colleague, Congresswoman Elisa Slotkin, who represents Michigan's 8th Congressional District and is an incredible advocate for our nation's veterans.
Good afternoon, everyone. I'm Elisa Slotkin. I represent Michigan's 8th District. And I want to thank Dr. Ruiz, Chairman Takano, Representative Luria. I am new to the Veteran Affairs Committee. This was my first term being on this committee, and one of the reasons I joined the committee was to work on the issue of burn pits. I'm really encouraged that we are highlighting this issue and have raised it to this level. It's a very personal issue for me. I served 3 tours in Iraq as a CIA officer alongside the military. I lived next to a burn pit on all 3 of my tours, as did everyone who served. My husband, who was a retired Army colonel, did multiple tours in the Persian Gulf, in Iraq, all over the world, and now my stepdaughter is an active duty Army officer serving abroad. So this issue is quite personal for us, and I will tell you that I do feel that burn pits are our generation's Agent Orange. And the task for us now is to decide how we're going to respond. Are we going to make these veterans of our generation wait 30, 40, even 50 years for their recognition, or are we going to learn the lessons from that process and not do the same thing to this generation's veterans? I will also say that I think that what you see behind us here is an example of how Congress is supposed to work. Almost exactly 2 years ago, I know some of us had our first meeting with the Johns in a crowded room in Longworth office building. We stuffed in there to learn about this issue, and we heard directly from folks who had had the experience of fighting for their life at the same time they were fighting the bureaucratic system at the VA. And the pain of that experience, of having to convince the people who are providing you care that you deserve access to testing, to research, really struck me as a double wound for some of our veterans. We started working. There are many of us in Congress on both sides of the aisle who feel strongly about this issue. And this idea that if you send men and women into harm's way to defend their country, you have a pact with them for the rest of their lives to take care of them and to hear them. I want to thank Chairman Takano for his leadership. There is no way a bill like this moves forward without the support of the chair, the active interest in getting something done. I want to thank our VSO partners. Again, this is how it's supposed to work. You hear something from the ground up, the VSOs and activists bring it to Congress. They find members on both sides of the aisle who care about it. And less than 2 years later, we are passing a landmark piece of toxic exposure legislation. I'm proud to be a part of this group. I'm proud to be working on this issue, and I'm now proud to turn it over to Christina Keenan, Associate Director of Disability Assistance and Memorial Affairs for the VFW. Christina.
On behalf of the men and women of the Veterans of Foreign Wars of the United States and its auxiliary, I appreciate the opportunity to speak today about the Honoring Our Pact Act. I'm an Army veteran of the post-9/11 era. My mother was an Air Force veteran of the Vietnam era. She passed away recently from interstitial lung disease, one of the conditions listed in this legislation. One of her nurses stated that this disease was very rare but often seen in veterans. We'll never know if this rare disease was linked to her time in service because she passed away days after receiving her diagnosis. Many veterans of her generation didn't trust VA to treat their health conditions resulting from their service. Unlike veterans today who are filing claims for conditions related to toxic exposures, attempting to access VA health care only to be denied or turned away. Toxic exposures have touched every generation of veterans and has become synonymous with service. Congress has the power to change the process through which the Department of Veterans Affairs grants benefits for veterans suffering from conditions associated with toxic exposures. The Honoring Our Pact Act would help millions of veterans by establishing a framework to address any exposure, foreign or domestic, past, present, and future. This legislation would add to the VA's list of presumptive conditions related to burn pits and other exposures. It would help atomic veterans, Vietnam-era veterans, including those who served in Thailand, Cambodia, and Laos. It would help veterans who served in the Middle East, Afghanistan, at K2 in Uzbekistan, and beyond. Additionally, this legislation would provide health care for all toxic exposed veterans. We urge Congress to do the right thing for our veterans and not wait for VA. The piecemeal approach of the past, of passing separate pieces of legislation for each exposure, location, or condition, is simply a disservice to our veterans, many of whom cannot wait any longer. Now is the time to pass a comprehensive solution. Congress has the opportunity and the responsibility to ensure that the vital care and benefits are provided for those who served and sacrificed for our nation. The VFW thanks Chairman Takano, Chair Luria, Congressman Ruiz, Congresswoman Slotkin, and all the members who are part of this legislation, Jon Stewart and John Feal, and our fellow veteran service organizations, and everyone who has brought so much attention to this important issue. The time to act is now. Thank you. I'd like to now introduce Joy Ilham, National Legislative Director for the Disabled American Veterans.
Thanks, Christina. Again, I'm Joy Elam, National Legislative Director for DAV Disabled American Veterans. As an Army veteran, I'm here, proud to be here on behalf of DAV's million members to stand together with the leaders and advocates you see here today, all of us united in a common goal, and finally enacting comprehensive toxic exposure legislation. The Honoring Our Pact Act addresses a number of critical, long-standing issues that DAV has had as priorities, and for veterans who have suffered health consequences from exposure to burn pits and other toxic substances. The legislation includes critical provisions to establish a concession of exposure to airborne hazards from burn pits, provide needed health care for toxic exposed veterans, create new presumptions for conditions covering burn pits, and expand Agent Orange conditions for Vietnam veterans. Finally, and importantly, the bill would establish a permanent framework for presumptive decision-making so that veterans never again have to wait decades for the health care and benefits they need and deserve. Like my fellow VSOs, DAV is grateful for the leadership of Chairman Takano, Subcommittee Chair Luria, Ranking Member Bost, Representatives Ruiz, Slotkin, and Meyer, and so many others who've played a pivotal role in getting us where we are today. We know that to become law, this landmark legislation will need to be broad, bipartisan, and bicameral support. And therefore, we are pleased that the Senate Veterans Affairs Committee is also taking important action today by marking up their own toxic exposure bill, the Cost of War Act. We know that the legislative path ahead will not likely be easy, but with the commitment and the leadership demonstrated here today in the House, working together with the Chairman Tester, Ranking Member Moran, and others in the Senate, the possibility of passing comprehensive toxic exposure legislation has never been greater. So we look forward to working with all of our colleagues and allies here today to bring this long overdue recognition, support, and justice to veterans suffering the exposure to burn pits and other toxic substances. Thank you. I'm now pleased to introduce Tom Porter, Executive Vice President of Iraq and Afghanistan Veterans of America. Tom?
Thank you all for being here. I'm Tom Porter with IAVA. Some of you know Travis Hoare that's standing in the back there. He works in our legislative shop. IAVA's top priority is this issue, dealing with toxic exposures. It's the key health impact for veterans of the post 9/11 wars. And we've done a lot of advocacy on this issue over the years. And in recent weeks, one of the chief arguments or opposition to moving forward with something like this, something so ambitious, is the cost of doing this. And my chief argument against this is this. I was in that building on 9/11. I was working across the street for the chairman of the Armed Services Committee when we launched the wars in Iraq and Afghanistan. I don't remember a lot of members on the Hill arguing about whether or not paying the cost is worth it to go after the terrorists on the front end of these wars. So we shouldn't be raising the same concerns on the back end of these wars when we're still paying the same costs of war, whether or not this cost is worth paying. It's worth it. You've all heard how many of these veterans of Iraq and Afghanistan and the post 9/11 conflicts, you've all heard how many exposure that they've suffered. I won't give you all the stats of that, but just to give you a little bit, IAVA does an annual survey of post 9/11 veterans within our membership, and so huge of an impact that 8 in 10 of post 9/11 veterans say that they've suffered toxic exposures during their deployments, and more than 80% of those say they're suffering health impacts due to those. And so that's why we have to do this, and we have to do this now. We're pleased to be working here with Chairman Takano. He's been a true champion and a good friend of ours over the years. Sometimes he's been the only one in our corner, and we really appreciate your friendship on this, and we know that you're going to stick with it. We know that your colleagues are going to stick with it. It means a lot to us, and we know that you're going to see this through to the end. Congressman Ruiz, it means so much to Congressman Ruiz. He would come across to the Senate side, believe it or not, to come and talk toxic exposures when we were trying to develop this legislation. So thank you all, and we have your backs going forward, so please don't quit on us, because we're not going to quit on this either. No one in Congress should pretend to honor the sacrifices of our troops on this 20th anniversary of the 9/11 attacks while not paying for the full cost of war and supporting these injured veterans. When I volunteered to deploy overseas, no one asked me how I was going to pay for it. Everyone needs to understand the war isn't over for service members when they get back to the U.S. The war continues and the impacts to our health, oftentimes years afterwards, and our government needs to ensure that they get the care that they deserve. Thank you very much, and thank all of you.
Our next speaker is Alex Morosky of the Wounded Warrior Project Government Affairs Specialist.
Thank you, Mr. Chairman. Good morning. My name is Alex Morosky with Wounded Warrior Project. I want to start off by thanking Chairman Takano for inviting us to participate in this event, and then also recognize Representatives Luria, Ruiz, and Slotkin, as well as our fellow VSOs John Feal and Jon Stewart. It's good to be here with all of you today. As it's already been mentioned, this year, September 11th, will mark the 20th anniversary of the beginning of the global war on terrorism. And since then, young Americans, like myself and so many others that are here today, have steadily continued to volunteer for service in the U.S. military, understanding the high probability that they'd be deployed to combat in places like Iraq and Afghanistan. And they did so with some understanding of the risks to life and limb posed by enemy fire, roadside bombs, and other dangers. What they did not understand was the very real possibility that they would experience prolonged exposure to toxic fumes from burn pits and other hazardous chemicals that they would not be able to avoid, and that these could result in serious illnesses like respiratory illnesses, cancers, and other conditions that would follow them long after they return home. Then, in addition to the problems caused by the illnesses, they come to find out that it's extremely difficult to get health care they need, since service connection is the gateway to VA health care eligibility. And their claims for service connection are denied largely because they either can't prove the exposure occurred while in service, which is often never documented in the first place, and without being able to show proof of exposure due to lack of records, VA is not willing to say that their illnesses were caused by the exposure. So veterans find themselves in a catch-22 without access to benefits or care. In fact, we estimate there's as many as 750,000 Iraq and Afghanistan veterans who are currently ineligible for VA health care enrollment due to the fact that they've been unable to establish a service-connected disability within 5 years of discharge. That's 750,000 veterans who served in areas of known exposure who are now operating without a safety net should they become ill. And we don't think that any of them should ever be turned away from the care that they need. Unfortunately, this isn't unique. Vietnam veterans face similar challenges gaining access to care and benefits from exposure to Agent Orange. And because of this, over the decades, Congress has enacted a series of laws that's created a fair process to allow them to access their benefits. And their long and hard-fought victories helped establish a list of presumptive disabilities associated with Agent Orange, a concession of exposure so they don't have to continue to prove they were exposed when claiming conditions that aren't yet presumptive, a scientific framework to add new presumptions, and permanent access to health care regardless of their disability status. And this is very important from a preventative care standpoint as well as those who are already ill. Multiple bills have been introduced in the 117th Congress that would accomplish these things for current era veterans, and Wounded Warrior Project strongly believes that they're all important: presumption, concession, a framework, and health care. And we also believe that current and future generations should have parity with what's been done for previous generations. In other words, if it's good for them, it's good for us. So that's why we are, rather than picking only one bill to support this year, we've asked Congress to put them all together like pieces of a puzzle to create a lasting solution for all veterans who are exposed now and in the future. We've also asked Congress to move swiftly on this, since time is a luxury that many ill veterans just don't have. The time to act is now. And with this event today, they are doing just that. We know that there's still a long road ahead, but we strongly believe that caring for exposed veterans must be viewed as part of the cost of war, and we know Chairman Takano and other members of the committee agree with that as well. So once again, we'd like to thank Chairman Takano for making this issue a top priority, and we look forward to working with him and the committee to get a comprehensive toxic exposure bill over the finish line this year. And with that, I'd like to introduce the speaker who really needs no introduction. He's a highly dedicated and tireless veterans advocate and a person we are very fortunate to have with us on this issue, Mr. Jon Stewart. Jon.
Hey guys, we are almost halfway through our program. And today really reminds us to give a hat tip to our founding fathers who in their infinite wisdom looked around our majestic country and all the temperate climates and thought to build the Capitol in a humid, fetid swamp. And I urge you all watching at home, if you have not been to Washington, D.C. for its Dead Cicada Festival, you really should come by. It's a sight to behold. The majestic cicada on the ground, squished by many Brooks Brothers loafers. So when Rosie Torres of the group Burn Pit 360 contacted John Feal and myself because she noticed there was a great analogous situation happening with our veterans that happened with the 9/11 community due to exposures, you know, we jumped at the chance to offer any help or any service that we could possibly offer. And when we came down and we first started having our meetings with the various VSOs and the various stakeholders of the issue, back when people could meet indoors in close quarters, it was really fascinating. Because we asked all the veteran service organizations and all these groups, what would fix this problem? And they all said the same thing. Well, we need a presumption of the various cancers and respiratory illnesses and immunodeficient disorders and lymphomas that are occurring in the veterans population for all these toxic exposures. And we need a way around the VBA, the Veterans Benefit Association, because that's the access to care. And we've got to get in from a different door because we're not being able to get in, and we can't get presumption. And we said, well, that's so clear cut. They had an incredibly clear-eyed vision of what it would take to fix this problem. And the fascinating part was, great, so let's work on that. And they said, well, hold on a second. And then they started to talk about what they think they could get. And it reminded us that Congress's reticence and inaction has caused our veterans community over these many years to negotiate against itself, to negotiate against the need that they have and the need that their population has against the purse strings that the VA and the Congress were holding over them. And that's why I am finally encouraged, because when we see the hard work that all these VSOs are doing and all these Congress people are doing, and the bills that are coming out today and are going to come out of the Senate, that they're finally recognizing that the consequence of war is not another line item in the budget that you can ignore. You know, to put this in the only terms that somebody of my age can understand, defense contractors can't view the U.S. Congress as Willy Wonka's chocolate factory, while veterans are back there like Oliver with a bowl of gruel asking, please, sir, may I have some more? It's bullshit, and it's got to stop. And if these bills can finally end this cycle for the veterans, and as Alex said, for future veterans, then we have to get this done. And the conversation should no longer be about, do we have the need, and should there be presumption? It should purely be the House and the Senate and the VA and the President of the United States getting together to talk about how to implement these programs efficiently and smartly so that these veterans finally get the care. You know, we can't brag about, hey man, it took us 21 years to recognize the toxic toll on Vietnam veterans, and we've done it in 19. Not good enough. And so these guys have put in place a framework that's going to address this injustice for good. And we can't let up. And so our job is only to make sure that the pressure continues and the kind of numbers crunching that goes on. It can't be about, geez, I don't know if we should add head and neck cancers because that's going to add another $100 million. Like, no more. What's the need? What's the way to implement to get the need cared for? And let's get the damn thing done. So thank you all very much, and I really appreciate it. And I will introduce partner in crime, Mr. Jon Feal.
I want to thank Mrs. Stewart for the opening act, because I'm the real show. You know, 6 weeks ago, we stood a couple blocks from here, and I said we're going to get a bill passed this year. We're going to get a bill passed this year. Then I said, why aren't we talking about the VA implementing a system? We've had 6 weeks to have that discussion. We're 6 weeks into that press conference to this one, to one they're going to do later in the Senate to introduce their bill. We have a presumptive bill. And when the two chambers get together to negotiate, this is now presumptive. So Congressman so-and-so or Senator Yahoo can't go, well, let's cut this illness out and let's cut that toxin out, let's cut that country out. This is presumptive. If you presume that this toxin caused that cancer, then you can't say, well, that toxin didn't cause that cancer when we know it does. So if it's presumptive, it's broad. So if you're going to introduce a bill over there that has 7 illnesses, and you introduce a bill over here that has, how many? 28 illnesses, then when this goes to conference and they reconcile and they negotiate, it better have 28 or more, not 7. Because then we're leaving these men and women behind. I've been coming here for 17 years. Nobody's going to outwork John or I. No one's going to outsmart us. Nobody's politics are bigger than our will. Nobody's politics are bigger than our empathy. This bill has empathy. Empathy. What a concept. Congress, empathy. It can be done. We can truly make this a bipartisan effort where America is going to get behind this, and no one's constituents are going to say, oh my God, I can't believe you helped veterans, just stupid, I'm not voting for you. Never going to happen. Never going to happen. But today, starting today, the VA can be the hero in all of this. The VA can take the ball and run with it. And the VA can say to the Senate and the House, we want to work with you. We want to implement when those people come forward. We want to take care of our heroes. The best of what this nation has ever offered are our service members. We want to help them. Thank you.
Thank you, Jon Feal, for your dogged advocacy. I just noticed the birds started to sing as they were singing amen. That's amen and bird talk. And, I want to thank Jon Stewart, who I heard drove twice, but I know the reason why he went back to New York now is that he did not want to stay here in Washington with the cicadas. So I now open it up for questions from you all. Yes, go ahead.
I have a question. So obviously all of these pieces of the comprehensive bill are important. Is there a risk of putting this all together in a comprehensive bill and then conferencing with the Senate and losing pieces of this when each of these bills matter to a veteran? Would it be, more beneficial to take something like the war fighters, burn pits, toxic burn pits exposure, get that passed and make sure they get the help they need? Or how do you see this going forward, and how do you ensure that every veteran gets these benefits?
I think the experience of our Vietnam War veterans, and I want to be especially thankful to that generation of veterans, has really taught us a lesson. I was the chairman that got the Blue Water Navy bill through, and I don't say that as a matter of pride. I say that as a matter of almost sheer relief that we got it done. After 10 years, my colleague Tim Walz got that bill through to acknowledge just a big piece of what should have been included in the beginning. It should not take decades for any group of veterans to get what is justly due to them. In this bill, we include taking care of about 100 atomic veterans that were exposed on an atoll in the Pacific. A cleanup. It's Grace Ming's bill. It's the Mark Takai Atomic Veterans Bill. My heart broke for hearing the stories of those veterans who were clearly exposed to nuclear radiation and yet could not get their benefits. It should not be a matter of your political or clout just because you're only 100 in number versus thousands and thousands. And that's why we have to. That's why it cannot be a piecemeal bill. I do not believe there is a risk, to go to the heart of your question. I believe there is substantial support in the Senate for a comprehensive solution. The question to me is, will the Senate be bold and include presumptions? I think Jon Stewart hit it on the head. Will they include presumptions? And I'm going to keep doing that, Dr. Ruiz. He's the authority here. He's the Harvard-trained doctor, and he did the painstaking work to provide, I think, the validity for including these presumptions. And it's my hope that this afternoon we're going to see senators on both sides of the aisle come to an agreement on the presumption. The presumption, I think, is the big part of the bill that we are, if it gets done, it will be a matter of, as I think Jon Stewart said, a matter of negotiating how many. We will have crossed that bridge. So I don't see a risk. I see we're in a really great place here. We have tremendous momentum thanks to the work of our advocates in the community, like the two Johns, and the veteran service organizations. They have made this a priority, and I intend, as my colleague Kai Kahele would say, to ride this wave completely into the shore.
Can I just add to that? You know, the VSOs and the Johns, we're going to be able to be part of that, and they're going to have to come back to us and say whether we like something or not. And this is going to be a complete team effort where we'll all say, yes, we're good with that, no, we're not good with that. And that's how legislation gets passed. It's going to take this group effort. And I think everybody will have an equal say when we see the finished product.
Yes, go ahead.
Hi, thanks for doing this. I'm just curious, on your side of the House, what's the timeline for bringing this bill to committee and getting it on the floor?
Tomorrow afternoon on the floor by and then
we got to bring the members back to session, John. They're on resource. We will be having hearings on our next major markup when members come back into session in the middle of this month. They're currently on recess for another couple of weeks, but the Senate is marking up today. We intend to do our markup quickly thereafter, so that's more or less the timeline. And I hope we get this done, by the fall or by the end of the summer. Yes.
Chairman, I don't see any Republicans up here, and I know VA has had some conversations with you. Do you think you can bring both of them onto this? Do you see this as being bipartisan and things are changing?
I think so. A lot of the tone will be set by, fairly evenly divided committee in the Senate. I see that there's a lot of political will and momentum on both sides in the Senate, and I think a lot of the House members will be taking their cue. But that's unfair to some of those Republican House members. A lot of their work is included in today's bill, including the ranking member's bill. Ranking member Boss' bill is included. We just need to keep creating more political space, and that political space is created, frankly, by the attention being brought to the public, by the work of our veteran service organizations, and by tremendous public advocacy, by John Feal and Jon Stewart.
And what about VA? Have you been able to talk to them about the impact of this?
I will be having an opportunity to spend extended time with the Secretary this Friday before Memorial Day. It was the first topic I brought up with him when he was confirmed, and he's undergoing a review and getting his policy legs as we speak. But I can assure you, Secretary McDonough is very engaged on the issue.
Can I add something real quick? I just want to make sure everybody understands. This is not a surprise to the United States government. This is not a surprise to the Pentagon. This is not a surprise to the VA. This is not a surprise to the EPA. And I know that because the internal documents of the VA in 2010 sent out a list of all the diseases that they thought were going to start rolling through because of the toxins that were associated. And attached to that list are all the different toxins that they knew everybody was being exposed to in 2010. The Pentagon has their internal documents where they were told, these are the toxins that our soldiers are being exposed to. This is the effect that it's going to have on them. The EPA has internal documents. This is why we can't do burn pits in the United States. These are the toxins. This is how it's going to go. Dioxins, benzene, PFAS, all that. None of it is a surprise. The only thing that hasn't happened is action. So no more excuses and no more, geez, this is the first time we're hearing about it. It's not. They know this is coming. This is no surprise.
Woo. Any other questions?
I got frosty.
Okay. Well, we don't want to prolong our time in this beautiful, balmy Washington, D.C. weather. So thank you all for turning out. Thank you.
John.
I couldn't believe I was walking over. Stand right behind you, and we've all got
That's me.
That's Katie.
We're an Army family.
That's all right. We were a Navy family. You know what? It was our leadership. I didn't have in my eyes. So
Yeah, sure.
All right, sir.
All right, thank you, brother. Thank you.
That's great. I'm actually feeling encouraged for the first time on this stuff, so we'll see what happens.
That's good.
But hopefully they're not going to nitpick, you know. They're going to understand what the problem is.
Well, what's really great about you guys is you help focus the mind. Press the pain.
There's so many different groups working all towards a goal, but they're not necessarily working together. And so we just try and like kind of bring them together to focus their efforts. They're the ones doing all our work. Yeah, those are the ones doing all of our work.
Well, you know, it was really helpful. I think a couple of years ago they had a round table quarterly with the speaker, and they all were singing off the same page. So what's the big? And they all said it's the topic exposure. I mean, everyone said the same thing, and that clarity. This guy,
oh man,
this guy,
he actually knows what he's talking about.
And look, we have a veteran voice. She's tremendous. This is our chair.
We just can't let him squiggle out of it. You know what I mean? That's all. And that's the only thing John and I can do is try and bring attention to it from you guys. This is really finally the most comprehensive effort. Now, if we can just switch the VA mode to implementation, then I think we really got it. Then we're moving.
We still got implementation issues related to Blue Water Navy and all of that. So
understood.
The IT issues and everything. So that's the
but with
the nuts and bolts.
The thing that I look at is this. If you look at the VA in terms of physical wounds, it's world class. And that's an intentional decision made on the types, understanding the types of injuries that are coming towards you, adaptive rehabilitation, prosthetics. Like that's all world class, the highest level of care that you can get. It's just a question of treating toxic wounds with that same level of priority. It can be done, and that organization can do it because they've proven they can do it. All they have to do is turn their attention and start listening to experts on toxic exposure instead of like